and talk about the use of where technology is enabling more efficient management of benefits, and to talk really about, health and well-being is Mary Cain, Senior Director, Clinical Strategy and Behavior Change for Jiff, one of the leaders in providing an enterprise benefit platform to major employers. Mary, good morning.
Good morning.
Hey, thanks for getting up bright and early to join us from the West Coast. Appreciate it.
No problem.
Mary, before we kind of jump into, understanding engagement and employee health programs, give our audience just a little bit of background on Jiff, if you would, please.
Sure. Jiff is an employee health benefits platform, and a lot of what we do is help employers bring together and offer to the individual employee a single place to go for their health and wellness benefits. So our platform is designed to bring everything together and using incentives and amazing, beautiful, intuitive design, create a delightful experience for the employee. We've had a lot of success at actually changing and improving the engagement, what your previous caller was just talking about, improving the ability to engage employees to interact with these different solutions that employers are paying for.
Yeah. Talk a little bit about, we want to talk about, kind of your sweet spot is that, the title is kind of cracking the nut on behavior change, really understanding engagement and employee health programs. Kind of help us get our arms around, that, if you would, please.
Yeah, so I think, and I really appreciated the comments from Mr. Kavanaugh from Accolade. I think that a lot of what he talked about resonates well with how I also think about individuals engaging in their health and healthcare journey. One of the things that's really important to recognize is that people play different roles and have different motivations depending upon where they are in the journey. In some cases, somebody is being thrown into a situation that they're not necessarily prepared for, and they're acting as a patient. They might be in a very passive role where things are being done to them. In other situations, people might be more active and be making decisions much like a consumer. And so they're playing a consumer role where they're looking for information and they're trying to figure out how to make their decisions. And then there's folks who are unhappy with how things are going in their healthcare journey, and they're acting in more of an activist or advocate role. And in each of these roles, people have different motivations, they've got different needs for information, they've got different needs for empathy and support. And I think it's important to recognize that people play different roles depending on where they are in the system and where they are in their needs. I think the other thing that's important to think about is motivation and how to utilize or leverage an individual's motivation, understand and leverage an individual's motivation with regard to helping them make the changes that they want to make. And my background, my background is in chronic disease management programs, building them for disease management companies and wellness companies. And one of the things that we found, well, there are two things that we paid attention to. One was this notion of patient activation and understanding how do I relate to my healthcare? How do I relate to managing my healthcare? Am I an active manager where I know everything that's going on, I know how to prevent exacerbation, and when I have a problem or stress or a relapse, I have an ability to come back from that to some degree, might be connected to resilience as well? Or am I a person who really is, again, quite passive and thinks that things are being done to me and I'm just like this is the way I was born and I'm not necessarily as activated? So that's one thing that we think about in the context of coaching people. Another thing that we think about is motivation and the motivation spectrum generally, and this notion of intrinsic versus extrinsic motivation. And intrinsic motivation is the holy grail, understanding how to help somebody do the right thing because it feels good for them. Taking a walk is something that feels good for them. Eating well feels good to them, and they do it for the pleasure of doing it, as opposed to extrinsic motivation, which are all the drivers that we're often using in health and wellness to try to drive people to engage more with their benefits. And one thing I'll add, and then I'll stop talking for a little bit, is extrinsic motivation that is closest to intrinsic motivation is something that's aligned with my values and my identity as an individual. So If my family and hanging out with my kids is really important to me, then that's something that's a potential hook as a motivation for me related to my health. And what's interesting is that the opposite end of the spectrum of extrinsic motivation is actually money. So paying people incentives to do things is absolutely something that works as a way to get interest and to get people involved. I think the jury is out as to whether or not that's something that will create sustained behavior change, because it's not as connected to necessarily to my values and how I see myself.
Mary, address what we call the non-engaged population, where a lot of techniques, a lot of, programs, education have tried to engage them but have failed in getting them to change health behaviors over and over again. How do you address that target group? If I'm an employer, how do you help me address that target group?
Well, I think that there's, again, thinking about motivation, I think that there's a couple of, and I'll actually think about motivation and activation in this context. Thinking about motivation, I think it's important to understand for individuals, my values might also be connected to the values and norm of the culture or the community of my employer. So if I'm connected to my job, if I'm connected to the people around me, in this notion of social contagion, their norms are norms that are more likely to be my norms. And so if you can create a culture at an organization where, taking walks at lunchtime is a normal thing, having walking meetings for one-on-one conversations is a normal thing, then those norms start to be expected for everybody within the organization. And that's one way of maybe getting people who aren't necessarily going to participate on their own, is by creating a culture that kind of expects people to behave in a certain way. I think something else to think about in the context of activation, again, is that you need to start with very baby steps. So if you recognize that this person is not somebody who's activated, and you create a situation where you're asking them to take on something that's potentially very overwhelming or much larger than they could potentially do otherwise, you're setting that person up for failure. So figuring out ways to spark their interest and get them involved in very, without it being a massive lift for that individual is another opportunity. At Jiff, we've used a lot of, frankly, marketing campaigns, and we've been very successful at getting people engaged. So much so that we've had kind of twice the average engagement for things like biometric screening, and we've had kind of amazing results. And I really attribute it to the creative marketing and also moving into techniques that have been used in other industries, such as personality segmentation, not just clinical segmentation. So really understanding what underlies the individual's approach to their health and motivation. And in some situations, you're not going to be able to get everybody, and you just need to recognize that.
Right. What are some of the key challenges that that Jiff has faced in creating this sustained behavior change?
I think that the health insurance, health and wellness benefits are not, haven't really embraced and been able to incorporate how other industries engage individuals and how other industries market to and communicate with individuals. Part of that is just that what we're talking about as a topic is relatively complex. And I again, on Mr. Kavanaugh's comments, this notion of helping people navigate a system, navigate this journey of something that they've been thrown into, sort of usually against their will, often in a situation where they don't have the same amount of information as others in the system, and they're kind of expected to step in and know what they're doing. And there's a lack of empathy generally. So I think our challenge, one of our biggest challenges, is just the complexity of what we're dealing with. And what we found is that in most situations, we're going into an employer where those benefits have sat on a static portal behind an intranet wall, not available to the individual in their moment of need. And so by being mobile first, our focus is really, let's bring the information to the individual. Let's encourage them to understand what the opportunities are by giving them deeper experiences initially, and hopefully being able to get that muscle memory generated by having them interact with some of these services that they may not need for 6 months, right? So, yeah.
If I'm a major employer listening to this program today, senior benefit leader, what are really 3 key things that you would want them to consider in building an employee health and benefit program that will ultimately successfully help them change employee behavior and improve health?
Well, I think that it's clear that individuals are interested in improving their health, right? They're spending billions of dollars on diet plans, on Weight Watchers, on gym membership. And granted, yes, we might say that those are the engaged individuals, but even in an engaged population, you're going to find, some 25% of that population is going to have a chronic illness that they're also managing. So, thinking about where innovation is coming from, it's not coming from within the healthcare industry. It's coming from consumer-directed products. So being able to have those consumer-directed products, consumer products available for individuals, and being able to harness the innovation by having a system that allows them to swap out solutions or bring in solutions that are engaging and are understanding how to engage individuals with regard to healthy behavior change, I think is one thing to keep in mind. So being aware that innovation is continually happening, and it's probably not happening within healthcare, but more along the edges and from other industries that are figuring out how to do things that healthcare isn't necessarily figuring out how to do. I think another thing to keep in mind is, the fish thinks from the head down, right? If an organization wants to have a healthy culture, it's important for the leadership in that organization to embrace and understand how to create a culture that includes norms that are related to health, communication that's related to health. It's not something that's a once-a-year open enrollment type of experience. It's a daily experience of creating opportunities for people to be healthy and figuring out how to provide the environment and the incentives to help people be healthy. I think the last thing is that personalization and creating an experience that's not a generic one-size-fits-all experience is key. For something to be valuable to me, I have to feel like that I'm getting my money's worth out of it. I'm getting I'm getting value from whatever I'm putting my investing in, right? So if I'm an individual employee, I hope that you're creating something for me that isn't just something that is off the shelf, but rather is tuned to me and my needs as an individual, because everybody has their own definition of what health and well-being means to them and their own set of needs around that.
That's good, Mary. Let our audience know how they can get in contact with you, please.
Sure. It's mcain, MCAIN, @jiff.com.
Mary, listen, that's a great discussion. I look forward to reconnecting sometime in the future and continuing this discussion as we continue kind of to evolve the consumer and help them kind of make these right choices. You have a great weekend, and again, I thank you for your time today.